Hello friends, coming towards the another lecture of ECG lecture series. In this lecture, I will discuss about the 12 lead ECG and their relationship to the heart. I hope you have seen my first lecture. In that, I have explained about the P wave, Q wave, R wave, their normal values, their normal duration. If we know the normal duration, at least we are very sure that this is normal and this reading is abnormal. So coming towards the today's lecture, 12 lead ECG. In this, we know it's very basic, but we will the most important part of this 12 lead ECG is the relationship to the heart. We will discuss in coming. See, six lead. There are six limb leads and there are six chest leads. In six chest leads, we know six limb leads are. In that also there are unipolar and there are bipolar leads. In bipolar leads, there are first, second, and third. In unipolar leads, they are AVR. We know augmented voltage gated, right? AVF and AVL. These are the 12 leads ECG. And now we need to know that limb leads, where they are placed. Limb leads are placed in such a way that they bisect heart in coronal plane. What do you mean by coronal plane? Is see, this is the heart structure, the upper surface. This is coronal plane. In this coronal plane, you can say that this wave is lead first, lead AVR, lead AVL, lead second, lead AVF, and lead 3, like this. This is the coronal plane. Limb leads, they divide the heart, they bisect the heart in this fashion. In after a few minutes, I will discuss about the axis deviation also in this lecture. So now you know the limb leads, their positions. Now, after having said about limb leads, chest leads, what they do? They bisect heart in horizontal plane. In horizontal plane, like that. This is the normal heart structure. They bisect the heart like this, horizontal plane. So we can say that V1, V2, V3, V4, V5, V6. Okay, got it. And now coming towards the importance of this position of the heart, of the limb leads. See, now the most important part, the relationship. This comes the significant part, relationship of 12 lead ECG to heart. Whenever we say there is inferior wall MI, anterior wall MI, lateral wall MI, why we say? Because the leads coming in the lateral side of heart are causing the problems. So that is lateral wall MI, inferior wall MI. So like this, if there is a problem in lead V2 or V1, V1 or V2, then it's septal wall MI, because the lead V1 and V2 are related with septal wall of the heart. Now lead V3, V4, these are related with anterior wall of heart. Anterior wall of heart. Okay, got it? Am I clear to you? Lead first, AVL and V5, V6, they are related with the lateral wall of heart. Lead second and lead 3 and AVF, they are related with inferior wall. inferior wall. So we know, we many times we have heard there is inferior wall mi, there is a lateral wall mi, there is a anterior wall, there is some septal wall. So what does it denotes? It denotes the inferior wall. So it means there is a changes in the lead second, lead 3 and are prominent. Lateral wall is the same, there are changes in lead 1 avl or v2 to v56. Anterior wall v3 v4. So this is the very most important part. We need to focus on the relationship of the limb leads to the heart. Now coming towards the another topic, that is axis deviation. Now axis deviation is also important. Axis deviation, what does in axis deviation? The axis is can be positive, can be negative, can be isoelectric. To see for the axis deviation, only and only go for the lead 1 and lead avf. We no need to see other leads, just these two leads for the axis deviation. Many times even me also was confused so much, that what is left and right axis deviation, so confusing. Just we need to see the lead 1 and lead avf, compare it between two, positive or there. So is just some general example I will give you. You can learn by trick. See, this is p wave, this is q, this is rqrs t, this is lead 1, this is avf. Only compare with this, this is this, everything is same. So this is normal axis deviation. Now coming to this, this is in lead 1, lead second, lead this this part is more. Don't for the diagrams. See, the direction of these two lead limbs are same direction. If they are same direction, if they are in same direction, then what will happen? And see, compare on this side. Sorry, sorry for the poor diagram. So in this, now this is, oh sorry, this is right axis deviation when lead 1 and lead avf, sorry, not to lead evf, they are on the same direction, that qrs complex on same direction, then that is right axis deviation. When these two waves are leaving each other like this, the direction is opposite, this is left axis deviation. Is very easiest way to explain this. Axis deviation is very simple. The direction of, see the direction of lead 1 and lead avf. If they are on the same side, their vector in our same side, either their vector is in this fashion or they are leaving each other. If they are leaving each other, we can say left axis deviation. If they are same side, there is normal axis deviation. If they are pointing to each other, there is right axis deviation. Having discussed about this axis deviation, just go through quick the causes of right axis deviation and left axis deviation. Right axis deviation is right ventricular hypertrophy, can be in right bundle branch block, left posterior hemiblock, or emphysema, can be in core pulmonale, can be in Fallot's tetralogy. Right axis deviation. Left axis deviation is more dangerous. It can be in left ventricular hypertrophy, can be left bundle branch block, and left anterior hemiblock, and can be in WPW syndrome, can be seen in hypertrophic cardiomyopathy. Okay, right axis deviation, these are the causes we need to look in the lead 1 and lead EVF. If we can go through this, it will be very easy for us to the axis deviations. Thank you for watching this.